Então, tell us what is the highlight of the attend the ICUH for you, and how does this differ from the other international conference?
I think this conference is very unique in that it brings together people from health and public health, prevention of diseases, to people who work with the urban planning, with transportation, with the actual decision making. We had a very good mixture of people with completely different perspectives and contributions to make for this connection between health and the urban and land use development. So we think that I think this is a very unique opportunity, and that's why, as the World Health Organization, we came as a large group of people to contribute and to learn from and to exchange with the groups here.
Okay, so what you see are the most critical health challenges that cities are facing nowadays?
I think the most critical and the greatest opportunities are in the interface between the environment and the urban environment and the built environment and the wider environment. I'll be more specific. Climate change and air pollution. You have immediately now in the world, there's more deaths from air pollution than there are from tobacco. This is a very big issue. How do you solve air pollution? You get public policies in cities, in urban areas, transportation, energy, land use, green areas. That's what's going to produce less climate change. That's what's going to produce less air pollution, and that's what's going to produce more health. Now, this conference is about putting those pieces together, because most people work in a silo, in one discipline by discipline. What we're doing here is to bring it all together, having this broad picture and seeing where each one's contribution can be made in that context.
You were talking about opportunities. The next question is about opportunities. What you see are the main opportunities that are emerging, that are the most important for the good governance of cities?
In WHO, what we're seeing is that the health community, which is very strong, and which exists in every city. Every city has a health center or have some people working public health. Now, these colleagues, they're not yet equipped to work with the urban environment or provide advice to individuals they should take one means of transport versus another, how they could elect a cleaner way of heating or lighting their homes or cooking. So that's the kind of advice. We're very good as doctors, and I'm a doctor, in advising about behaviors, don't smoke, eat well, do exercise. But we haven't yet developed this capacity to advise on the rest of the environment, especially in the urban environment. So I think what we see is the big opportunity is getting these health professionals equipped and enthused and energized to interact with citizens and with communities to provide that kind of advice. So we think they really can provide and help the transformation that cities today need to be more cleaner, more climate friendly, and also more health friendly. So we believe health professionals really have a key role to play, and the conference brings health professionals in contact with the urbanists, and that's what we think is so exciting about being here.